My name is Carly Hansen-Prince, and I'm a faculty member in the Diagnostic Imaging Program at Lynn-Benton Community College in Lebanon, Oregon. And today I'm here to show you how to create a plaster phantom bottom that can be used to help X-ray students practice simulating tipping for contrast enema exams. Because that's oftentimes the thing that students are most afraid of. They're not afraid of all of the various pictures that we have to take afterwards. It's kind of getting over that initial hurdle of, I have to do what? And so this provides students an opportunity to talk through something that tends to be kind of awkward at first. It also gives them an opportunity to practice working on their poker faces. And if things don't go well that first time around, they can have a redo and have an opportunity to talk about what they can do different and then give it a go. So here are the supplies that you're going to need.
For the plaster work, you're going to need some scissors and some fabric. And I just ended up cutting up an old twin-sized flat sheet that I had available. Or you can look for other types of fabric, just cotton seems to work best. You'll also need about 4 cups of plaster of Paris. So plaster of Paris can be purchased at home improvement stores, and you're going to end up using a 2-to-1 ratio of plaster of Paris to water. And when I mixed this up, I made sure I did it in small amounts. So I just did 2 cups of plaster to 1 cup of water at a time, just because it does tend to set up rather quickly. You'll want to mix the water and the plaster together in a bowl. I like the silicone bowls just because it just made for easier cleanup to get that plaster, any plaster that dries, out of the bowl, and then a whisk. Of course, it will be impossible to create a plaster model without a live human volunteer. So hopefully you can find somebody who is willing to contribute to your program in the grandest of ways. And you're also going to need copious amounts of petroleum jelly to help protect their skin as you are creating the plaster cast. To protect your clothing through the plastering and crafting portions of this project, you'll want to have an apron. You'll also need some drop cloths to lie on the floor in the area where you're going to be plastering, just to prevent that from getting into your flooring. You'll also want to have a sturdy surface for your volunteer to lie on as you're creating that plaster cast. I chose to use a sturdy work table. You could also use other surfaces, so just consider what do you have available, or if nothing else, you could try the floor. A closed system enema container with an air contrast retention enema tip is the kind I chose to use for this project. And certainly you can choose to use something different depending on the resources that you have available to you. Now to provide the enema tip with a place to go, we're going to need a 2-foot piece of vinyl tubing. So it should have a 1¼ inch outside diameter and a 1 inch inside diameter. And this tubing is something that you can generally purchase at a home improvement store, oftentimes by the foot in the plumbing section. You'll also need a 1 inch PVC end cap. And to adhere that PVC end cap to the vinyl tubing, I found that PVC cement usually works pretty well. Now to create a space in the end of that vinyl tubing that can accept an inflated enema tip balloon, you're going to need a propane or a butane torch. To help give the plaster bottom a little extra realism, you'll need some acrylic paint in a flesh tone of your choice, a paintbrush to apply that. You might also consider purchasing an inexpensive doll from a dollar store type location that you can give a haircut and then use the hot glue gun to adhere the doll hair to the phantom. You'll also need the hot glue gun to do some other gluing throughout the project, so have a couple extra glue sticks handy. Supplies necessary for creating the pseudo-anus include gasket rubber, again something that can be purchased at a home improvement store in the plumbing section. You'll also need a marker and some scissors and a scalpel or a utility knife. Now if you'd like to practice barium on and barium off and run some water from the enema bag through the tubing and into the phantom, you're going to need a 2-liter bottle with a cap to catch that water. And if you'd like to make that water look a little more realistic when you drain the phantom, you might consider adding a little bit of cocoa powder and some chili flakes. And to get the cocoa powder and chili flakes into the bottle with the least amount of mess, you'll also need a funnel. Some drilling will be required for this project, so having a cordless drill is extremely helpful, as are the following attachments. You'll need a hole saw with a 1 3/4 inch bore, and a large unibit, sometimes they're also called step bits, and a small unibit. If you'd like a written list of supplies, please email me at hansenc@linbenton.edu. Prior to beginning the plastering process, have your volunteer apply petroleum jelly to their backside, or if they need assistance, certainly you could help as well. And once they're lying prone on the surface, I would encourage you to put down a small piece of fabric in any areas where there might be extra hair. That way, when it comes time to lift that plaster cast off of their bottom, you're not going to end up pulling a bunch of hair with it and causing your volunteer a great deal of discomfort.
So next up, I'm going to paint the plaster bottom, and I picked up some acrylic paint at a local craft supply warehouse, and I just picked a color that was close to the flesh tone of the X-Ray Phantom that we have in our lab. And so I'm just going to go ahead and give this a quick coat or two, and then I'm going to let it dry. Stage 2 in the project involves preparing the vinyl tubing for attachment to the plaster bottom. So there's a number of things that have to happen with this piece. The first is we're going to have to expand this area down near the bottom of the vinyl tubing so that it can accept an inflated enema tip balloon. So this involves heating it with a propane or butane torch and then blowing into it. Kind of like, if you've ever done glass blowing, same basic idea. So we'll use our breath to expand that heated vinyl so that it can accept that inflated balloon. We're also going to need to prepare a pseudo-anus. So we'll be drilling a hole through the end of this PVC end cap and then gluing in some gasket rubber on the inside and cutting a little crosshair in the middle so that the tip can go in. We'll also need to drill a hole into the cap of a 2-liter soda bottle. And so the 2-liter soda bottle will go on one end, and then the cap here will go on the other end. And so what this does is it allows water to travel through the tubing and then into the storage bottle. So that way, again, students can practice barium on and barium off. And then they can also practice draining the barium. Now, in terms of some safety considerations as you get ready for the second portion, if you're good with power tools, fantastic. If you're not so good with power tools, kind of like me, then invite somebody who is to help you out with the drilling pieces. You could also invite somebody to help you out with the expansion of the tubing when you're heating it with that butane torch. And when you do it, make sure that you're in a well-ventilated area, so open windows, doors. I also had a fan going just to, again, keep those vapors that are escaping kind of hopefully out of your lungs. And then just be mindful to not get your torch too close, because if you do, it certainly will light on fire. And just be careful. So use some eye protection, and you might even consider using some gloves. So the next step, now that the phantom bottom is dry, is I need to drill a hole down in this area so that this tubing where we have our rubber passageway is going to be able to be put in place. And I'm going to orient it in such a way that the tubing is going to run like this. So here in a little while we will attach this to the phantom. So this will go on the phantom's backside, and then this tubing will run between the phantom's legs, and so this portion will kind of be up in the torso area. Now that everything is glued into place and I have painted the exterior so that everything matches, the last thing that I'm going to do is I'm going to add a little bit of extra realism by giving a dollar store doll a haircut and gluing that to the perimeter. Alright, so the hair is glued on, and I fully acknowledge that it may be just a little bit over the top, but at the same time, people's bodies have hair, and students often don't necessarily expect that there's going to be hair in this area. And so this is a really great opportunity to, again, work on that poker face and work through seeing something that's kind of surprising at first, so that way when it does happen in the real world with a real patient, again, they're going to be able to maintain that professional demeanor. So now that the phantom is complete, what we're going to do is take this to the X-ray lab. So I'll show you how it can be attached to an X-ray phantom and set up for a simulation for contrast enema tipping. I'd like to introduce you to our light body X-ray phantom. Her name is Gertie, and so what I'm going to do next is I'm going to tape that plaster bottom onto her backside so we can get started. First step is we're going to roll Gertie over onto her left side. Get her hands up by her head like she's sleeping. So basically getting her into that Sims position. It seems to be a little bit easier for setting up the phantom. Then it's time to go ahead and adhere this to her body. So I have my phantom bottom with my tubing. I also have my 2-liter soda bottle with my cocoa powder and my chili flakes. And I'm just going to start by lifting her down. So I'm going to go ahead and feed this tubing in between her legs and try and run it up her torso area. And then I'm going to try and figure out how do I position this so that, again, it's in a fairly realistic place. And it may not be exact, but you know, it's okay. So it is a simulation. It's not going to be perfect, but I'm just going to try and get her organized here. Get that gown pulled out. So it looks like it's in a pretty realistic spot. And now I can check it from the front, and I can see where, again, this tubing is. So now what I'm going to do is I'm going to go ahead and attach my soda bottle to that cap here on the other end of the tube. And make sure we have a secure connection. Okay. And then just do my best to kind of obscure it. So sometimes that's easier said than done. But that's okay. I can always put another sheet over her or another gown over her just to, again, help keep that stuff organized. So I find it helpful to tape along the backside and wrap that and tape that to the phantom body here, and then also do a strip of tape this way around the leg and then this way around the other leg. So So I am going to give her another gown. And this way, again, I'm going to be able to cover her up just a little bit better. So that way we can keep it a little bit more of a surprise. And if you want, you could even just drape another sheet over the top, just again helping to protect and preserve her modesty before the exam. And now she's ready for a student. Now before we get started with the Phantom, I usually invite students to get some practice gauging the temperature of water. So we would simulate like we're using a barium enema kit that requires water to be added. And so this is a great opportunity to talk about, again, what's an appropriate temperature of water to use. And I invite students to try and see if they can figure out what that feels like by running the faucet. And then we check it with a digital thermometer. The other thing we talk about doing is bleeding the line, so making sure that the barium or other contrast is going to run all the way down to within about 2 inches of the enema tip, and checking the balloon, always making sure that your balloon is going to work, and getting the lubricant ready. So we usually ask them to get out a couple of paper towels, and then we would squirt a little bit of the lubricant onto the paper towel so that they'll be able to coat the enema tip. And I always say err on the side of more than less. We know that injury can happen if an inadequate amount of lubricant is used. So again, making sure that that entire enema tip is coated is important. Okay, Gertie. So we're ready to get started, and it's great you're already laying on your left side and you've got your right leg forward, so that's fantastic. What's going to happen next is I'm going to get you uncovered and we're going to get that enema tip put in place, okay? Alright, so first thing is I'm just going to take that sheet off of you, okay? And you're just going to feel me lifting your gown, okay? And we'll get that up and out of the way. Next thing that's going to happen is you're going to feel my hand on your right bottom, okay? So I'm just going to lift it up. Okay. And here in a moment, I'm going to ask you to take in a big breath and then blow it all the way out. And when you do that, that's when I'm going to insert the tip, okay? All right, Gertie. So right now, go ahead and take a big breath in. Good. And blow that breath all the way out. Good. And the tip's going in on 1, 2, 3. Okay. Breathe and relax. Okay, good job. I'm just going to get you covered back up here. Okay, and I'm going to go get the radiologist. Now, depending on the student's clinical site, some are instructed to inflate the balloon, and so that's certainly something that we can practice here. So now I've changed my gloves, so I got some clean gloves on, and then what I can do is go ahead and give that balloon a little puff of air. Okay. Now, depending on how much time you have for a particular lab or a particular station rotation, you certainly can go through, rolling the patient around into different positions. The other thing that I like to do is go ahead and have students practice barium on and barium off. And so when that happens, I will actually have them go ahead and unclamp the tubing, and we're going to let that water run in. And it might be necessary to kind of rock the Phantom patient around just so that, again, that water is going to go into that 2-liter bottle. All right, we talked about the post films, and certainly if you had time, perhaps you could even work that into the simulation. But for right now, what I'm going to do is we're going to simulate draining. So I'm going to go ahead and place this enema bag on the floor. And I'm going to assist the Phantom with the draining, just because, again, we want students to see that the water that comes out is not the same color as the water that went in. And sometimes you do have to sit the Phantom up just a little bit, just to, again, let gravity help you out here with that 2-liter bottle and let things flow. Now that the contrast has been drained, the next step is removal and disposal. So what needs to happen first, don't ever forget, deflate the balloon. And we coach students on, don't ever throw these away. So we're going to put this in a place over here. Okay. Also tell students to take this blue device off. So again, don't throw that away either. Okay. And then the next step is to, again, talk to the patient step by step what's going to happen. Okay, Gertie, it's time to remove that enema tip. So now, Gertie, you're just going to feel me uncover your back here. Okay. And then I'm going to place my hand on your right bottom, and I'm going to lift it up. Okay. And Gertie, right now what I want you to do is go ahead and take a breath in and blow that breath all the way out. And I'm going to pull it out. Okay, good job. Breathe and relax. Let me get you covered back up here. And now it's time for disposal into a red hazardous waste bag, and then assist the patient up and help them to get their bearings, and then assist them to the restroom. So those are the basics of how to create your own plaster bottom to be used to help students practice simulating tipping and untipping patients for contrast enema exams. If you have any questions or you want to brainstorm together, feel free to send me an email, and I'd love to collaborate. Thanks for watching.